Parts of our healthcare delivery system do need fixing. Workers feel locked to their jobs because they get their health insurance from their job. And no one knows what anything costs. Even doctors don't know. As a result, everything costs more. Obamacare doesn't even address those problems, but it's supposed to solve all kinds of other problems.
You have turned, Mr. President, the right of every American to have access to decent health care into reality for the first time in American history.
Yippee. And Obamacare does promise to cover the uninsured and somehow to lower costs. And maybe it will. It's early yet. But I'm skeptical, and Obamacare is already creating some new problems. Let's talk to a doctor about that. Orthopedic surgeon John Barrasso. I should also say he's a U.S. Senator. So, John, what's that giant stack of paper next to you?
This is the red tape tower, John. It's over 7 feet tall, and these are just the regulations that have come out so far because of the Obama health care law. There's over 20,000 pages. You and I thought that the health care law, which was over 2,000 pages, was too long. But remember, so many times it said the Secretary of Health and Human Services will write the rules and regulations. This is just the first part of them that doctors and nurses and hospitals and patients and insurance companies all have to comply with under the president's health care law.
So that's the first part, more to come. But what about the goal? The uninsured, 40 million, 50, 20, whatever it is. It's a noble goal. Get them insurance.
Well, the president actually continued to use the word coverage instead of using the word care in the debate. Because just because you have a Medicaid card, which is the way the president seems to want to solve this, doesn't mean you can actually get care. What people wanted in health care reform was the care that they need from a doctor they choose at lower costs. But the president has failed in terms of trying to bring the cost down. Remember, he said by the end of his first term, families would see their insurance premiums drop by about $2,500 per family per year. No one has seen that. And in fact, if you go to a town hall meeting and you ask people how many of them think that they're paying more for health care under the president's health care law, all the hands go up. And then you ask them, do you think that the quality and availability of your care will be better? Nobody thinks that. Even Kathleen Sebelius finally admitted, she's the Secretary of Health and Human Services, that under the health care law there would be winners as well as losers. Well, many more people now believe they're going to be losers under the president's health care law.
And the costs are already going up. Associated Press reports claims costs are up 32%. I never quite understood how you could cover more people and have it cost less.
And the president has actually compounded the problem under the government mandates that you have to buy government-approved insurance, which isn't necessarily the insurance that you think works for you and your family in terms of what you want or need or can afford. You have to buy a very expensive level of coverage because it has to cover so many things, many of the things that things aren't necessarily that are right for you or your family.
I see on the list every policy now must cover preventative care, mammograms, colonoscopy without any deductible, breastfeeding support, supplies, and counseling. So everybody has to pay for that even if you don't want it.
Everyone has to pay for government-mandated insurance, which has a whole long list of things that they have to cover. And, of course, the rates are going to go up if you have to buy a lot of things that you don't want.
All right, but what would you do about the poor? Without government, won't the poor suffer?
We need to make sure. I wanted to focus on getting actually the rates of insurance down so people could get the care they need from a doctor they choose at lower costs. But I don't think it helps anyone when the cost of care and the cost of insurance continues to go up under the president's health care law.
The other problem is that you're exempt if you run a business and you have fewer than 50 employees. So I hear businesses are saying, I'm not going to expand. I got 49 workers. That's it.
Well, the Federal Reserve is actually in its beige book last month said that one of the big drags on the economy in this country, the reason that people aren't expanding or businesses aren't expanding, people aren't being hired, is because of the uncertainty as well as the mandates in the health care law. Part of it is the number of 50 employees or fewer, so they're not hiring more people into those businesses. The other is in terms of full-time or part-time employees. We see now that one of the largest movie theater chains in the country has now said for all of their folks that are paid by the hour, they're going to be part-time workers only, which is anything less than 30 hours, because businesses aren't mandated to cover part-time workers, but they are mandated to cover the full-time workers. So you see in businesses, and we've talked to some, where they say, gee, we have an opening. Instead of hiring one full-time person, we're going to hire 2 part-time workers instead of, because of the health care law. The health care law is dragging down our economy, making it harder to people to find full-time work.
Thank you, Senator Barrasso. All these laws have unintended consequences.
Thank you, John.
And let's look at that big 7-foot pile again. There it is. And the Secretary shall continue to write new rules, it says in the bill, and they will grow.